Most of us crawl into bed, not giving our sleep position much thought. Whatever your preferred position, spread eagle or peaceful shavasana, we all aim to wake feeling rested and limber. You may wonder if there's an ideal sleep position for better health, as in better breathing and fewer morning aches. Let's take a moment to look at a few sleeping positions and how they can affect your health. What are the sleep positions? 1. Side sleeping. Most adults prefer this sleep position, and for good reason. It's great for relieving back pain and improving gut and brain health. When pregnant, side sleeping makes it easier for the heart to pump blood through the body and prevents the baby from putting pressure on the vein that carries blood back from the lower extremities to the heart. Those with a breathing-related sleep disorder called sleep apnea, where breathing can pause up to 300 times a night, are also advised to sleep on their side. Studies have shown that side sleeping can reduce apnea events by half and is recommended as a viable treatment option for non-obese sleep apnea patients. And if you're wondering if there is a better side to sleep on, there's a connection between certain sleep sides and specific health conditions. The left side may provide more benefits for pregnant moms and those experiencing gastroesophageal reflux disease, GERD. However, sleeping on the right side has been shown to create optimal conditions for heart health. Right side sleeping creates more space in the chest cavity, putting less pressure on the heart and reducing its nighttime workload, a critical point for people who have had cardiac events. 2. Back sleeping. Although some benefits can be had from back sleeping, such as relief of joint pain or developing less facial wrinkling over time, this position is not recommended for those with sleep apnea or non-apnea snoring. It's also not recommended during pregnancy, as it has been linked to fetal cerebral redistribution. In this condition, there is a preferential blood flow toward the baby's brain at the expense of other vital organs. 3. Front or stomach sleeping. This position may be beneficial for those with sleep apnea, as the natural head positioning here lends itself to the tongue pulling forward. In those with sleep apnea, the laxity of the tongue can cause it to collapse inwards into the throat and interfere with breathing while asleep. The drawbacks of this position include an increased strain on the back and neck, which can lead to soreness upon waking, and is not recommended during pregnancy, even in the earliest stages. Keep watching, because we're about to give you some tips on how to change up your sleep position. How do you change your sleep position? The good news is that you can change your sleep position if it aligns differently with your health concerns. To start, you can experiment with different sleep positions and bedding to achieve this goal. Your pillow should provide sufficient support for your shoulders, but have enough give to relax your neck. If you're a stomach sleeper, consider using a flat or no pillow to protect your neck. For side sleeping, consider placing a pillow between your legs to prevent your knee joints from rubbing together as you sleep. Back sleepers should consider a medium-firm mattress and place a pillow under the knees to help maintain back curvature and avoid backaches. Another factor that should be taken into consideration is sleep hygiene. Practicing good sleep hygiene and finding your perfect sleep position can provide the ultimate foundation for healthful sleep. What's the takeaway? The best sleeping position should be based on how it makes you feel, and it may be something other than your preferred position. For example, you may feel comfortable splayed out in bed on your back, but may notice that your breathing is affected, waking you up due to discomfort. You may also fall asleep easily on your side, but then wake up sore on the side on which you rested your weight all night. As a rule, it may be time to alter your sleeping position if you feel tired and achy upon waking. If you have trouble sleeping after making changes to your sleep position, talk to your doctor. Help is available.